All to our 7th annual COPD Education Day, Exercise, Empowerment, and More. Please take seats up front if you guys can. We're going to all be doing a lot of exercising, so try to spread out a little so you don't bang into your neighbor. We're very excited to have some breaking new topics to discuss with you, as well as some of our old favorites. And it's great to see some familiar and some new faces. We hope you had a chance to visit as many of the exhibitors upstairs as possible. They will be here until 2 o'clock, most of them. So if you have any burning questions after our presentation, you'll be able to catch them for the last half an hour after lunch. Housekeeping reminder, bathrooms are outside and down the stairs that is right next to where you came in this morning. And parking. We are told that sheriffs sometimes enforce parking even on weekends, so make sure you're in a legal space. You can park at Queens Miller Street, POB 1 or POB 2, or Ali'i Place. They do fine and they do tow. Validations for Queens is available from the Queens staff right behind the registration desk. And if anyone needs assistive hearing devices, those are also available at the Queens right behind the registration desk. And if anyone is interested, there are envelopes at the registration desk. If anyone wants an envelope to make a donation, we appreciate any tax-deductible donations made as well. Be sure to complete your survey and evaluation form. That's this pink one, and 5 is the highest and 1 is the lowest. So if you liked us, it would be a 5. If you didn't like it, it would be a 1 or somewhere in between. And the other side as well, we're trying to make sure that we meet your needs as well as possible, and we only can do that if you give us feedback. Let's see. And we're very fortunate once again to have the golden voice of radio that braved the Hawaii Kai traffic to get here. Please join me in welcoming Hawaii Public Radio's Executive Director and talk show host and co-host of The Conversation and Town Square, Beth Ann Kozlovich.
Good morning. Nice to see all of you here. Well, in case you were wondering whether it's raining outside still, one look at my hair should tell you yes. It's going to be a very bad hair day, but that's okay. It's going to be a very good day in here. So, first of all, I wanted to tell you what a pleasure it is to again be here with you. This has become an annual event for me, I think, Val, for the last 5 years or so at least. And the reason is very simple. COPD touched my family's life with my father. And my father died of lung cancer about 7 years ago now. And before that was dealing with chronic emphysema. And our whole family, of course, was dealing with this. So somehow, the grief never goes away, as you know, if you've ever lost someone, and I would suspect you have. And sometimes the best way to deal with it is to help other people to deal with some of the very same issues that have taken a loved one. So that's what's in it for me, and also getting to see all of you on an annual basis. And so many young faces. Hi, you guys. Thank you for coming. Lovely to see you. Well, we have a lot of work to do and a lot of fun to have today. We're going to exercise and everything. Wow, Val. God, I love that part. Okay, so let's get going. Let me introduce to you our very first speaker. Dr. Julie Chang is certified in pulmonology and is also a hospitalist at Palimomi Medical Center. Please welcome her as our program chair for today's event and keynote speaker. And she'll be providing an introduction to COPD and latest updates, including new medications now available. Breathing specialist and hospitalist, Dr. Julie Chang.
Hi, good morning. So I'm going to talk a little bit about what COPD is and talk about some risk factors and treatments, okay? Some of you may be new to COPD, recently diagnosed, so we'll start out with some basics. Just touch the screen. No, so how do I just... Okay. So what exactly is COPD? So that stands for chronic obstructive pulmonary disease, and pulmonary means lung, so disease of the lung. So it's really a group of diseases, and essentially it's airflow restriction, and it causes trouble breathing. So most of the time we think about COPD, we think about emphysema or chronic bronchitis, but it can also include chronic obstructive asthma for people who actually were diagnosed with asthma and then were smokers. So COPD is really important, and sometimes I think lung diseases don't get enough attention, especially in the media. We hear a lot about cancer, we hear a lot about heart disease, but it's very important, and it's the third leading cause of death in the United States, and is probably going to increase because we're having better treatments with heart disease, and so that's going to now be dropping as a cause of death. But 15 million Americans are diagnosed with COPD, and millions more may be undiagnosed. I've seen plenty of patients that really do have COPD, but really never got diagnosed by their doctors, so I think it's definitely an underdiagnosed condition. Some symptoms of COPD: a chronic cough. A lot of times this will be called a smoker's cough. Chronic phlegm production. So your patients or family members may say they are always coughing up a lot of mucus, yellow phlegm, or some of my patients would say gala-galas. That's what they're talking about. A lot of times they'll start having shortness of breath with things they used to be able to do. Getting out, going to get mail from the mailbox, they might get short of breath where before they didn't have any problems. And they often say they have a difficulty not being able to take a deep breath or feel like they're not getting enough air. They also may have wheezing, which is a kind of a whistling sound or a squawking sound that they may hear. So what causes COPD? Pretty much the main cause in the United States is tobacco smoking. That's really the main cause here. There are other causes of COPD, including air pollutants at home, secondhand smoke, some heating fuels, which we would see in a lot of developing countries where they cook, open fire inside with poor ventilation, and use a lot of, animal products to cook. You can also be exposed at work if you're exposed to a lot of dust, gases, or fumes. That can also cause COPD. And if you have a genetic predisposition to COPD, for example, alpha-1 antitrypsin deficiency, you can develop COPD at a very young age. So some risk factors for COPD. If you're older than 40 years old, because most people would have to have a significant smoking history, so we don't typically see patients with COPD in their 20s and 30s unless they have alpha-1 antitrypsin deficiency. They have the symptoms that we described earlier, history of smoking or currently still smoking, exposure to the environmental or occupational pollutants, as we just described. And if you have some of these risk factors, it would be great to talk to your doctor about being tested for COPD using spirometry, which is a breathing test. Some doctors' offices actually have it in their office, and it's a quick, simple test, and it could determine if you have COPD. So the best way to prevent COPD is really smoking cessation. So speak to your doctor about strategies, whether it's quitting cold turkey or using a lot of the medications, Wellbutrin or Chantix, nicotine patches, gum. But if you can quit smoking, that is the most beneficial way to prevent COPD. Also avoiding pollutants, fumes, dust, secondhand smoke. So people who have COPD are also at increased risk for infections of the lung, like pneumonia, influenza. Also at increased risk of lung cancer because most of the time have a significant smoking history. Heart problems. If you have a lot of problems breathing, it causes a lot of stress on your heart and can cause problems with the heart as well. I always recommend to my patients that they should really have a flu shot every year in the fall to protect them, and also get a pneumonia vaccine at least one time. So treatment of COPD. Well, there is really no cure for COPD. So as we mentioned earlier, quitting smoking is the best way to prevent the disease to get worse or progress. There are many treatment options for COPD, including medications. A lot of those are inhalers. We have the short-acting inhalers like albuterol, or what we would call a rescue inhaler. Helps open up the lungs, makes you feel less short of breath. We have longer-term bronchodilators that last longer to help keep the airways open as well. Some of you may be on those. Spiriva is an example of one of those. There's also inhaled steroids that help to decrease the inflammation of the lung and help to control the disease as well. A lot of times you'll see some of these medications in combo form, for example, Advir. There are some newer medications out too as well. Trudora, which is a combination medication similar to Spiriva, and also there's one other one that's a pill. I can't think of the name right now. But that's also a new medications. One thing that also may help with COPD treatment is pulmonary rehabilitation. So this is where you learn exercises, you learn breathing techniques that help you breathe better and help you improve your quality of life. Pulmonary rehabilitation and medications do not extend, your life, but they do help with quality of life and definitely your breathing. If you do have severe COPD, you may need oxygen. Oxygen is very important. It's the only medication that actually does help extend your life. So if you do need oxygen and your doctor recommends it, then it would be a good thing to use. There are some other options, including surgery, lung volume reduction surgery, and that was something that was approved by the FDA. You have to have certain specific criteria to qualify for the lung reduction surgery. But for example, if you had severe emphysema located in the top lobes of your lung, you could have that area surgically removed, and it would allow the rest of the lung to function better, and therefore would improve your symptoms. However, this type of surgery does have a high morbidity and mortality, so it's not used very often. They also do have some newer techniques that have come out, bronchoscopic lung volume reduction, where instead of having open surgery, they would try and achieve the same thing using a bronchoscope, which is a little lighted tube that your lung doctor will take a look inside your lung, okay? And they have some techniques using one-way valves that allow air to go out but not back into the lung. They also have some techniques using solvents and whatnot, which will shrink the area of the lung that is diseased and then have the same effect that if you had surgery. And so they're looking at a lot of different modalities to help people who have severe COPD. However, none of those modalities, the bronchoscopic lung volume reduction, are currently FDA approved. Okay, so that's a little bit about the basics of COPD. Any questions? Okay, yes.
What is the most exciting thing for you as a physician when you work with patients that have COPD? How can they work the best to make a good partnership?
I think probably the best thing is, a patient that's flexible and willing to work with their doctor. There's a lot of different modalities that we can use to try and help their breathing. I'm probably the most excited when my patient actually quits smoking. That's the best thing. I know that can be a challenge. A lot of times the patient has to be, ready to quit smoking. Sometimes they're just not ready. But you need to talk to them about smoking cessation at every visit, and when they're ready to smoke, be willing to help them. I think that's probably the best key. Any other questions? Yes.
I have one. You was talking about the new medication that they have right now. I use Advair, so is there a medication you think is a lot better than what I'm using at, let's say, Advair?
There are different medications that are out, and the one that I was thinking about that I couldn't remember the pill is Dallas Rep. I think that Advair is a good medication. It's a combination medication that has an inhaled steroid that helps to treat the inflammation and actually the COPD, but it also has a long-acting bronchodilator, which is a medicine that helps open up the lungs, so it helps to keep you breathing easier for longer. They do have some newer medications out. Some of those are add-ons. For example, the pill form, the Dallas Rep, is an add-on if you have moderate to severe COPD. But some of the newer medicines, I'm not sure if they're really any better than what we have out now. Yes. The one that's the lung reduction volume surgery is. I know it's been more regulated recently. When the surgery first started, a lot of people were doing it, probably picking some patients that maybe weren't the most appropriate. So there was a high, morbidity and mortality with it. It is FDA approved. It is paid for by Medicare, but you have to have really the right patient, meeting the right criteria to get the best outcome. So that one is the bronchoscopic lung reduction. There's many different modalities that are currently being researched right now, but those are not FDA approved as of yet. Any other questions? I know a lot of people are using the e-cigs. Personally, I haven't had a lot of patients that have been using that. Most of them, unfortunately, quit smoking when they have a big change. They get diagnosed with lung cancer or they have a big heart attack. But there's a lot of other different medications, modalities. There's a great, tobacco quit line that I recommend a lot of my patients use, because I think it's not just medications, but they need someone to call when they're feeling like they want to smoke. And it's a great resource. They can get free patches regardless of what their insurance is. And I think they need that support. The e-cigs I know are coming out. A lot of people are starting to use them. I guess it's another modality to get the nicotine, so it's probably still better than actually having the cigarettes, which have a lot of the tar and the carcinogens and that cause lung cancer. Yes. Okay. Any other questions? Okay. Thank you.
And thank you, Dr. Chang, for the update. Always good to hear about where we're going, and just having a horizon of a few years to look back is always positive for me, too. Like having this longevity thing, it's a very good thing. Now, for our next speaker, we're going to be hearing from Dr. Bell. Dr. Charlene Bell is going to help us to take charge and talk about the role of tapping for better health. Dr. Bell? There she is. I almost couldn't see her.
Good morning, everyone. I'm happy to be here. I'm glad that Val asked me to come, and I hope some of the things that I will show you will help you to deal with your diagnosis. And I'm not going to be here, unfortunately, I have to leave right away. After I made the commitment to come here, I began to be assisting a girls cross-country team, and they're having a big meet at 12 o'clock, and they're quite nervous, so I'm going to be leaving right after this talk. And I hope I know how to operate this. Those of you who are here, some of you who are here are because you heard your doctor give you the diagnosis that you have COPD, which is chronic obstructive pulmonary disease. And perhaps the words that stand out the most would be chronic, meaning that there is no cure and that you will have this condition for a very, very long time, perhaps for the rest of your life. And obstructive, meaning the airflow in your lungs will be partly blocked, resulting in difficulty in breathing. And everyone's reaction is different, but it is very common for patients to react to this diagnosis with shock, dismay, fear, anger, asking why me, and a lot of confusion. Let me see if I can. Okay. Oh, it's here. I'm really new at this. Later, as you learn to deal with your illness and need to make life changes, as Dr. Chang said, 75% of COPD is caused by smoking. So considering to end your smoking may be a very difficult decision. And there is grief over the loss of what was, what you used to do, what you hoped to do, feeling overwhelmed with the changes in one's life and getting used to the new normal, which is quite abnormal as you live with this illness. And as a consequence, a patient may experience symptoms of sadness and depression. And I'll go over these symptoms with you, some of which you may not realize are symptoms of depression. And it's a feeling that life will never be okay again. You may have problems with sleep, concentration, and appetite, either increase or decrease of appetite, feeling blue or sad, not wanting to participate in activities and or associate with others, feeling irritable and angry, even thoughts of hurting oneself. And if these are symptoms that you see in yourself or your caregivers see or professionals see, then you should immediately see a trained mental health professional because these symptoms can be helped. Now, most of you here, all of you here, are because you've moved out of this boo-hoo stage and you want to get more information. And so we're going to talk about what you can do to take charge of your health, to be active rather than to be a victim of your condition. The first thing Dr. Chang did tell us is to partner with your doctor. Be an active, let's see, I'm going to change this. Okay. Be an active participant. Okay, be an active participant with your doctor. It's getting support, knowing that you need support. And take responsibility for being a part of this team and not being a victim, and be very active in telling your doctor how you feel, why you feel the way you do, whether you want to do certain things or don't want to do other things, and communicate this with your doctor and be very active and express yourself. The next thing you can do is to join a support group. And Val has a wonderful support group that meets in different places, I think once a month, or you could go 4 times a month at different places. This is where you will meet with people who have your symptoms, who have your problems, and it's good to know that you're not alone. You can also join an online group and meet with people online, either nationally or even internationally, who are experiencing your symptoms and who may know how to cope and give you suggestions on how to cope. And you can also volunteer to work with groups such as Val's support group. Now, the next thing you can do is to learn more about COPD. And if you're here, and you are here, you are learning so much. I was so impressed, Val, about all that information upstairs, that you can learn about your illness and learn to cope with it, and learn to deal with it, and learn to control it. You could also do your own research online, of course. And I have to tell you that sometimes, doctors are really, really busy, and they may not have the latest. And so sometimes you find something online, and you can talk to your doctor about that. Now, the third way is to decrease stress. And I'm going to talk about this for the rest of my presentation. Because when you feel stressed, a person tends to breathe up here, higher up, and they may start to hyperventilate as a result of having a stressful situation. And with COPD, this could really put you perhaps into a panic or a medical emergency. So we want to know how to deal with stress. And I'll just give you a few examples of what you can do, and you may think of others. You could read a book or watch a nice movie. You could try yoga, Tai Chi, or meditation. And you could participate in any kind of enjoyable activity, such as taking an art class, play an instrument, or listen to music. Last night I was at the Casamaro concert show at the Hawaii Theater. It was so relaxing. It was just really relaxing and wonderful. Or you could spend time with a friend, a nice friend. And what I'm going to show you now is you could use thought field therapy. Let me go back. Thought field therapy is a method developed by Dr. Roger Callahan, who is a American psychologist, and he developed this during the 1980s. When he was treating a woman who had a phobia or fear, he noticed that when she tapped under her eye, the phobia started becoming less and less, and she was eventually cured of her phobia. I'm not sure how he discovered the tapping under the eye, but that's what he said. And so he thought, well, maybe there are other parts of our bodies that we can tap that could help us. And so he developed, there's several different areas, and I'm going to show you today how to where and how to deal with stress. And there's one specific tapping that's especially good for COPD. Okay. This is, I I'm going to show you a really quick method to deal with anxiety, and we can all do it. And those of you who are students here, you can teach your patients how to do it, because I'm sure, you know, I went to a conference in New York, and they said that the waiting room is a hotbed for anxiety. It's a petri dish for anxiety as patients wait and have to wait for what's going to happen next. And so I'm going to have all of you try it, and you can tell there's 3 quickie methods, and you can see which one is maybe the best one for you. Okay, the first one is the eye roll. And so what I'd like you to do is look down on the floor and slowly, to the count of 10, raise your eyes to the ceiling. And when you get to the ceiling, close your eyes and then open them again. So look down at the floor and slowly count from 1 to 10. And when you get to the ceiling, just close your eyes and then open them again. Okay, that's one method you can try. And no one will know that you're doing it if you're in a big group of people. Okay? And you can, I'd like to know later, you know, really like to know how you responded. I will say that some people will feel nothing, and some people will really have sometimes a very profound effect in their bodies. Okay. The next one is to tap the side of your hand. And if you have to remember which side, is it this side or this side, if you close your fists, you will see this little skin that's right here, right under your baby finger. That's where I want you to tap, because that's called the karate point, where they hit things. So you tap that, and for some reason, that can relax you too. And if you're driving and you're having road rage, you can tap your steering wheel. So you don't have to let go of the wheel, just tap your steering wheel. Okay, now the third way that I found that a lot of people like, and it's called tapping your gamut spot. And the gamut spot, and I'm not sure why they named it that, but it's if you look at the groove between your baby finger and your little finger, you know, this groove right here, this little valley, you can tap it, and this tapping goes directly to your thyroid meridian. And you can do this in a meeting or in class. You put your hands under your desk and you can tap. And sometimes when I'm with a difficult patient, they can't see my hand, but I'm going like this. Okay, calm down. Okay. So these are quickie ways that you can relax. Now I'm going to show you a little bit more. It's not complicated. Now your card is a little bit more complicated, but what I'm going to do is just teach you the real quick, you don't have to look at the whole thing, just look at the tapping sequence for anxiety. And I'll explain where the tapping points are and where they go. Okay. The first one is under the eye, and this goes to your stomach. And the second is under your arm. Now, you can do one arm, or you could do 2 arms. It's under the arm. This goes to your spleen. And I'd like you to recognize, some people really have a strong reaction to one of them, you know. Like some people will say, oh, I feel like I'm being hugged. I like this one. And under the collarbone, if you find your collarbone here, tap under the collarbone. And this goes to your kidneys. Okay, let's do it 3 times. Okay, so this is where it goes. And if you forget, I just tell people to remember EAC, eye, arm, collarbone. So let's do it 3 times so you get the hang of it, and then you can give me some feedback about how you feel about that. Okay, under the eye, and then under the arm, and collarbone. Okay, let's go. Under the eye. Be aware of how you're feeling now. Under the arm. And if you can't do two, that's okay, just do one. And collarbone. So this is, as you do this and you repeat it, it should stay in your mind how to do it. Okay, under the eye, last time. Under the arm. And collarbone. Okay. Now, can I get some feedback from anyone who would like to tell me about the quick method and which one they liked? I really liked all of them. You liked all of them? Okay. Okay, good. Okay, good. Anyone else? Any reaction? You like this one?
Yeah, because where I work, I do it.
Oh, you do it. You do it already. You know how to do it.
Well, it's going to help me with my job.
Oh, okay. It'll help us with our jobs. That's right. And so, when you get into a situation where you're feeling nervous and anxious, you can just tap. Maybe it's at the doctor or you're meeting with somebody unpleasant or, you just tap. Okay. How about the eye, arm, collarbone? Anybody felt any special sensation that you felt, oh, this feels good? Smells like a massage. You like the eye? Everyone will be different, Some people really like the eye or they like the under the arm. And so just be aware of what your body is telling you. And I'm glad that you enjoyed that. So now we're going to do the tapping specifically for COPD. And this I have to credit Dr. Caroline Sakai, who was the lead psychologist at Kaiser, and she's now in private practice. And she was the one who taught me how to do this. I was a bit skeptical about tapping many years ago, but when I met her and she told me about the tapping, and my neighbor said she taps and she liked it. And they're using this method in the African country of Rwanda, where the people were brutally murdered. And so there were many, many people who were highly traumatized as a result of that. And so there's a Catholic priest and some other people working with him to help the people who are traumatized. And they're using this tapping method to deal with PTSD. And so Dr. Sakai gave me this method to share with you. And I'll explain. We'll do the different parts, and I'll explain where it is. Okay. I'm sorry, I did not do. Okay. Okay. Here it is. Now the side of the hand is what we've all done. This is the side of the hand. You start with that. Now we're going to tap two fingers. The first one is your middle. You could do either hand, left or right. But I'd like you to put your hands in front of you so you know which one to tap. You will tap the side of the finger facing your heart, so the side facing you. And it's the last or the first digit of the finger. So the middle finger here is your circulation. It's the end, the digit, okay? Then the thumb, this one is really important, I think, for COPD patients, is the lung meridian. Okay. Then it's under the nose, it's the governing vessel. I'm not sure where the governing vessel is, but it has to do with circulation. And under your lip is another central vessel. Now, if you're experiencing pain, you may want to tap your gamut spot. And they say, well, tap it maybe 30 times. And you don't have to count, you just keep tapping, tap, 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 if you're feeling pain. And then you do the collarbone. Okay, and we're going to do it 3 times, and then you can give me any kind of feedback that you have, because I'd be interested in knowing how you experience this tapping. So let's do, okay, side of the hand, then middle finger, thumb, under the nose, under the lip. And then if there's pain, and this can also help to relax. Okay, gamut spot, just tap maybe 30 times. And they say don't count, but the obsessive person will count, but we've already done it 30 times. And then the collarbone. Okay, let's do it again. Side of the hand. Middle finger. Thumb. Under the nose. Under the lip. Gamut spot. And then collarbone. Okay, and we'll do it one more time. And be aware of how your body's feeling. Okay. Side of the hand. Middle finger, circulation. Thumb, your lungs. Under the nose. Under the lip. Gamut spot. I hope you're feeling really relaxed. I am. Okay, collarbone. Okay, give me any kind of feedback, how you feel. Was there any spot that felt good, like the lung or, the palm, you like this one? Okay. How about those others back here? Any that you felt, yes? Oh. Uh-huh. Oh, good. Okay. She said at first it seemed disjointed, but when we kept repeating it, it kind of came together. I will tell you, this is just an anecdote, but for me, I have low thyroid. And so I've been teaching people how to do this. And then I realized my thyroid medication was getting too strong. I thought my thyroid was getting activated for some, it's very unscientific, but I told my doctor, I need to reduce my thyroid. My heart's just beating, extra beats. And so I talked to Dr. Sakai about, does this really activate your thyroid if it's underactive? And she said it does. So that's an anecdote. It was really interesting. So I don't know if tapping your thumb will do anything, but that's the lung meridian. Do you have any questions? Yes. When I get under stressful situations, when I do it, it goes down. But I do other things too, and you'll learn other things. I exercise a lot to get the stress out of my body. And so we all will experience stress. At the end of the day, you have to do something. And I did notice, before I did this, I really have to exercise, do cardio. And you'll learn more about that in the next speaker. Any other questions? Okay, thank you very much. Oh, sorry, how to do Valerie. Okay.
So now that you're all feeling great and relaxed and happy, I hope, from all of that, my mother is really big into tapping, and so she would come next to me sometimes and just start to do these things, because I get stressed sometimes before I have to do big events, and sometimes when we have a lot of interviews one after another. So I like the things you can do under the table. That works really well. Thank you so much, Dr. Bell. Now, just a quick reminder that with the exception of Dr. Bell, who obviously has to leave, so we're going to say goodbye. Thank you so much. And good luck with the cross-country team. Oh, boy. They're excited. All of the other docs will be available, docs and speakers will be available afterwards. So if you have a question that you don't feel like asking in front of everyone, feel free to ask privately. Okay, so now I think we're going to go on with our program and talk with Dr. Mary Kim about caregiving for COPD patients. Dr. Kim is right here, and she's making her way up. Thanks so much for being here. And I'm going to turn this over to you. Now, do you need oh, they're fixing it. Oh, good. So your screen should be okay now. Thank you.
Okay, good morning. Just to give you a little bit of information about me and about the caregiving that I did. My Hanai mother, who lives on the mainland, was the person that I was the caregiver for, and I was the primary caregiver for only a month, and a respite caregiver after that. And so, I'm sorry? Okay, let's see. Is it better? Okay, I'm just going to have to hold the mic, I think. So I was a primary caregiver for 1 month only, and then I was a respite caregiver afterwards for several years. So my experience as a caregiver came very much from the primary experience, because as a respite caregiver, I found that things were much easier. My Hanai mother was very happy to see me, and it was kind of like a vacation period for her and also for her caregivers. So if you have any questions, please ask me now, or you can ask me later, but I don't mind stopping if you have a question. Okay, now the slides are not that way. I'm sorry, this is going to take a minute for me to see what I need to do here. No? Oh, okay, perfect. Just a little review of COPD, that it does limit a person's autonomy, and as the condition progresses, it becomes increasingly difficult to engage in the activities of daily life. So it's a very difficult adjustment for the person, and it's not just one adjustment to make, but it's a series of adjustments. Every time there's an exacerbation of the COPD, anytime they go into the hospital for an infection, usually there's more of an adjustment when you get home because your level of activities and what you can do is decreased. The effects of every aspect of the person's life, and I'm going to go into that a little bit more in the next slide. And caregiving frequently leads to changes in your familiar relationship. With my Hanai mother and I, it was a role reversal where when I would come on vacation, she would always take care of me, and she took a lot of pride in that. And our roles changed, and that was very difficult for both of us. So that's something to keep in mind. Oops, and that's the wrong direction. Okay, the effects of COPD. The most obvious is that it's difficult to breathe, but the difficult breathing causes diminished oxygen to your entire body, and so it affects all the tissues in your body, and that's something to keep in mind. Your energy, the energy of the person you're taking care of, will be diminished, and onset of fatigue will be faster. You have a diminished desire to eat. Think of it when you have a cold and you can't smell and you can't taste very well, and it's like that almost all the time as the disease progresses. What I've heard is that oxygen therapy can also cause a decrease in smell and taste. And so when you're pushing someone to eat because you really want them to do that and you can see that they're losing weight, sometimes it's very hard for the person. And it just causes more difficulty in the relationship. They know they have to eat, but it just doesn't taste right. It just is not enjoyable as it used to be. There's a slowed healing of wounds. So when someone comes home from the hospital and they have maybe a trach wound or IV wounds, that's something you have to be aware of and be careful of, because the diminished healing of the wounds can lead to infections. And so that's something you have to keep an eye on. Forgetfulness and difficulty focusing are really common because you're not getting enough oxygen to your brain. And so you just don't pay attention to things like you used to. And when you can't pay attention to what's going on around you, you don't pick up on things, you may forget things, you may just have a lot of difficulty staying focused. And that's something to keep in mind as a caregiver, because it can be very, very frustrating. Because as a caregiver, you may have a lot on your mind, and it may be hard for you to focus too. And you may be forgetful, and you may have difficulty focusing. So it's the combination of the two of you having problems with all the things that you're having to cope with can lead to more difficulty in the relationship. Anxiety is very common for both the caregiver and the person with the COPD. The person with the COPD is dealing with a lot, and breathing difficulties can make you anxious. The caregiver is anxious because this may be a very new role for you, and you may be learning new skills, and you may not feel competent with them. So that's a source of anxiety. Depression may surface, and it often accompanies this type of situation where things are changing, and they're not changing for what you feel is the better. And so depression and anxiety are things that, as Dr. Bell was saying, you may want to get some help from a mental health professional. And my Hanai mother, I will call her C for reasons of privacy, did have a mental health professional that she'd worked with for many years, and so that was very helpful for her. The needs I saw as a caregiver, and this is what I've seen documented in the literature, are communication, which is a big one. Communication with your healthcare providers, communication with business, legal, financial, legal matters, communication just between the two of you and with family members. Timely access to coordinated medical care is very important and can be very anxiety-producing if you don't have it and you don't know how to get it. Point of contact information on medical and non-medical needs is really important. If you can pick someone who will always be there when you need medical information, that's a valuable number to keep. Very close. Non-medical, sometimes someone will have a lawyer that they can turn to or a financial manager that can help you out with business or legal things. And my Hanai mother had both, so that was really helpful. Training for in-home caregiving is really, really important. And a lot of people I see here today are health professionals or going into the health professional field. Something that may seem really easy to you is not so easy to someone who's never done it before. One of the reasons I took care of my Hanai mother when she first came out of the hospital, and I was volunteered to be the primary caregiver when she was discharged, was because I worked in a hospital. My past career was in infection control. And so I felt more comfortable, and she felt more comfortable with me being with her than other members of the family who had majored in art or business. So that was helpful, but not that helpful because I had to learn how to handle some new equipment and how to manage that. So it's really important to learn those skills and feel comfortable in them as a caregiver. You need to respect the person's decisions, and you may not always agree with them. And sometimes it's difficult because you just want to move things along. With my Hanai mother, she wanted a particular doctor, but the doctor was a neurologist, and the neurologist did not want to be handling her pulmonary problems. And the neurologist tried to explain that to her, and I tried to explain that to her. And it was just difficult to get beyond it. But we respected her decision, and we made time to explain it to her, the reasons why we couldn't honor it, and to help her find another doctor that she felt comfortable with. It takes time. when you're trying to get everything done during a day, to sit down and explain to someone why you can't honor their decision, but it's really important. Self-care for the caregiver is very important, and at the end I'm going to go into that a little bit more. Okay, to go into communication more, which I think is really primary for both the person with a COPD and the caregiver, communication with healthcare providers should include clear and consistent information. And like I was just saying about the instructions, you need to be really clear. For me, when I talk to patients, I have to really remember that things that seem very familiar to me are not very familiar to them. And I encourage people to ask me questions if I'm not being clear. Consistent information is really important too, because if you're hearing one thing from one healthcare professional and another thing from another, it can make you very uncomfortable with what you need to do, what your role is in the home, and who you need to turn to. So if you're getting inconsistent information, you need to go to that medical point person who can help you out. This was just something I included from a UCLA newsletter about how information needs to be provided in a way that people can understand it, and it needs to be consistent. Okay, you as a caregiver and also as a person with COPD, you need to feel comfortable communicating with your healthcare provider. It's really important to have someone you feel comfortable talking to. And you need to let them know what treatments are working for you, because as Dr. Chang said, there are many treatments you can try. And so you need to let your healthcare provider know what's working for you. You need to feel comfortable doing that. And let them know if something's not working for you. You need to feel comfortable asking questions. There are going to be a lot of questions that come up. And so if you have questions about a particular treatment you want to do, about a particular program you've heard or read about something that doesn't seem to be quite working for you, you need to feel comfortable as the person with COPD to ask the questions. And if you're not, your caregiver needs to be there to be an advocate for you. And you can be informed through support groups like the COPD Coalition. And I'm going to show you a number of references. I'm going to have more slides as references at the end that provide you with resources. And I'm going to go through them kind of quickly, but this will be on the COPD Coalition website, so you can look up the resources later. But I just wanted to let you know there are a lot out there, and they're available on the internet, or they're available by phone if you don't feel comfortable on the internet. And they're available on every island. Any prior difficulties that the caregiver and the person with COPD had in their relationship will increase initially. Things will come up. Sometimes it's just control issues. It's like, am I really in control of my body anymore for the person who has the disease process? And for the caregiver, it's you want to get things done, you want to help the person, you have a certain amount of duties that you have to do during the day to help them with their activities of daily living. And it can be frustrating if you're constantly having difficulties with who's in control. And so again, sometimes counseling or just consultation with a mental health specialist can help. There's a loss of autonomy on both sides, and you have to accept that for the person you're giving care to, and you have to accept it in yourself too. Because even though you may have chosen to be a caregiver, you're going to give up things to do that. And you may not realize at the time you make that choice to be a caregiver what you're going to have to give up. There can be negative emotions involved, and those are things that you should be mindful of. And outside support and coping strategies are really helpful. For when I was a caregiver, we had outside support from what they call the visiting nurse agency, and we had home health aides come in and home chore workers and visiting nurses. And so that gave my Hanai mother and I a break from each other, which was sometimes really helpful. One of the things that came up with her family, and I kept in mind, was that she had the COPD most likely due to cigarette smoking. She was a heavy tobacco user, but that was something in her past, and she had given up smoking. And I kept in mind what helped me deal with that was that American culture's view of tobacco smoking has changed over time. And when she was a young woman, and most of her adult life, cigarette smoking symbolized something very different than it did now. It was an expression of personal freedom. It showed that you were feisty and fun-loving and a little self-indulgent. And I think that's something that people don't always appreciate now, because now the cultural view is that it's very negative, that you're hurting yourself, that you're harming the people around you, that you're setting yourself up for a disease-filled future. But you have to keep in mind that a lot of the people that have COPD now had a very different view of tobacco smoking. And you have to keep in mind, too, that there are genetic factors involved in the development of COPD. And just to give you an idea, because many of you look like you weren't around when it was positive, when people thought of it as a positive thing to do, I added a few ads from Virginia Slims. So this is a Virginia Slims ad from 1971, where they state that they made Virginia Slims especially for women because they are biologically superior to men. So they're obviously trying to get women to buy their product. What it turns out with now is that women were not biologically superior to men with this particular disease. There are almost, when you look at the rates of COPD of new cases from 1980 to 2000, 25% more women than men who are being diagnosed with COPD. And the women are being diagnosed earlier, they're having more exacerbations, the disease progresses faster in many cases, and they have more psychosocial problems. I included another ad so that you could see that even in 1996, which isn't all that long ago, Virginia Slims was still putting it out there that if you wanted to lead the way, be fashionable, be sophisticated, you would smoke Virginia Slims. And just a few facts about nicotine. It causes a release of a chemical in your brain that elevates your mood and makes you feel very good. And it's often paired with pleasurable responses. And so as a psychologist, a lot of what you do is try to get people to look at pairings of behavior. And when you have something that's paired with a pleasurable response, it's really hard to change that behavior because it brings back such pleasant memories. And in the case of nicotine, it also causes release of chemicals that give you feelings of pleasure. So smoking tobacco can also be a coping skill because it can make you feel a little better. And it can bring on the feelings of pleasure. So when you're stressed, when you're sad or frustrated, many people use smoking as a coping skill. It's a hard habit to break. That's the point I want to make. So you can get down on somebody about how they're still smoking when they have COPD, but as Dr. Chang was saying, it really has to be the person's choice for them to quit. And getting down on somebody about something just makes for a lot of difficulty in your relationship. So, stressors for caregivers. You've probably been thinking of some as I spoke. The requirements of caregiving. They may be way more than you expected them to be. The impairment caused by the disease process in your loved one. The intensity of care that can grow over time or kind of go up and down as the person has exacerbations of the illness. The recurrence of the illness, which can be very frustrating and which you can kind of blame on yourself sometimes and think, oh, if only I'd done this or if only I'd done that, then my loved one wouldn't be back in the hospital with a recurrence of this disease. And it can cause a negative impact on the relationship because there's this sadness that you don't have the relationship that you used to have before. Some of the symptoms of stress are just presented in this slide. They can be body, they can be mind, behavior, or emotion. So you have to, as a caregiver, be mindful of what's going on. Are you having more headaches? Do you find yourself getting sick more? Are you tense all the time? Are you worrying a lot? Are you having confusion with your thinking, difficulty remembering? Are you having judgment problems? Are you indecisive? Are you more accident prone? Are you not taking time to do things like you should? Are you not eating? Are you having a loss of libido? And the drinking more here is alcohol. So are you using alcohol as a coping skill? Are you not sleeping at night? Are you having problems just being quiet? Are you very, very restless? If you're smoking, are you smoking more? Are you having a loss of confidence, maybe because you just don't feel like you're very good at this role? Are you more irritable? Are you feeling depression coming on? Be mindful of these things because they can indicate stress, and there are a lot of ways to cope with stress. But also, if you feel like you're really being overcome, or you feel like you just need somebody to talk to, counseling is a good alternative too. To reduce your stress, be knowledgeable about the disease processes so you can anticipate what's coming. Insist that you get the skills that you need. Identify your go-to people. Identify a support system. And it could be friends, it could be family, it could be professionals. Pick your battles. That's always good advice. Decide what is really important that you have to set limits on, and then be flexible about the other things that go on during the day. Identify your primary coping strategies and look for some new ones. And identify what you like for self-care. So Dr. Bell went through some coping strategies, but just to review or maybe give you some new ones, ask for help. See if there's family members or professionals that can help you. When a situation isn't going well and it becomes safe to leave the situation, take a break and let the person know that you just need to take a little break. It has nothing to do with them personally, but you need to step outside. Seek to understand the other person and not blame them. Be flexible, set boundaries. Sometimes people will want to take you out to give you a break, and maybe you just want to be alone. So be able to say no when people offer things that you might not want to do. Structure your day, stay organized, and pace yourself. Those were 3 that I found were really important. If I could think about what was going to go on during the day, what appointments we needed to make, what needed to be done around the house, what chores needed to be set up for the chore worker, I could structure the day and organize it and pace myself throughout the day. And those days were much better than days where I just hit the ground running. Be aware of your feelings. And self-care, the basics are sleep. We really need to get some sleep. It varies from individual to individual, but 7 to 9 hours is what the National Sleep Foundation says. Everybody can judge for themselves. I find, for me, 6 is the minimum. Avoid stimulants late in the day. Exercise is always good, and we're going to hear more about exercise from the next speaker. Establish a relaxing bedtime ritual. One of the things that I did was read before I went to bed. And so that was my way to kind of decompensate and then be able to sleep. Associate your bed with sleep. Don't watch TV there. Don't use your computer. And make sure that the sleep environment is pleasant and relaxing. For nutrition, be sure you eat regularly. It's very easy to let the day get away from you and you don't eat. If it's easier to eat 4 to 6 small meals than 3 big meals, then do that. Keep healthy. Don't snack on chocolate. Emotional eating is one of the bad coping skills that I used, and there was lots of places to buy chocolate and fudge, and that was never a good thing. So keep healthy snacks around and stay hydrated. Be sure and exercise because it increases your sense of well-being. It can give you a sense of control. It helps increase the production of chemicals that make you feel better. It changes your focus so that you're not focused on being angry or anxious or upset about something. You're focused more on what you're doing to exercise, and it can increase your self-confidence and improve your sleep. Do something that makes you happy almost every day if you can. And these are just some suggestions for self-care. And everybody has different things that they like to do for self-care, so choose something that you really enjoy that can relax you during the day. And these are just the COPD resources that will be available for you on the website with my slides. And there are many. There are 7 slides. And on the last slide, there are smoking cessation resources as well. So thank you very much. And I don't know if anybody has any questions or not. Okay, thank you.
Thanks, Mary, very much for all that. Wish we would have had as complete a list when we were doing caregiving of both my grandparents and my dad. That amounted to about 11 years of caregiving between my mom and me and playing tag team. That's how we originally got cell phones, too, because it was the only way we can make sure that we took care of our older folks and our really, really little folks, my children. And yeah, it was quite an adventure. Do want to say something about the sleep, though. You may have noticed that HuffPost Hawaii launched this week in Hawaii, and Ariana Huffington was here this past week and talked with her. On Wednesday, there was a luncheon with over 250 people packed into the Sheraton Waikiki Ballroom. And one of the biggest discussions about the third metric, which is a way of measuring life beyond power and wealth, and a big thing for Huffington Post, was this issue of sleep and how little sleep we're getting. And if you can imagine 250 people sitting in a luncheon talking about sleep, finally, perhaps we're trying to understand how important this really is, and that it's worth our time and worth the effort to make your bedroom a place where sleep is conducive. And so we all got lectures about how many places there were to go online to look about how not to be online. And that's kind of an interesting thing, too. You're using technology to teach you don't be on technology. So, yeah, having a really sort of electronic-free zone is a really big, important one, and we're only starting to tap into that. So thank you so much for such a really complete list. As I say, I wish you would have had it long, long ago. So now we're going to go from thinking a lot about how we live and the quality of life that we want to enjoy to getting up and moving around a little bit, madam. I think that's what you're going to have us do. Thank you so much. Next coming up is Lucille Chun. You can sometimes see her at Kahala Mall. I think I've seen you for sure. And Coco Marina, are you out there too? Oh, Hawaii. Oh, yeah, that's the hood. So you're going to get us up and moving. You have certification in Tai Chi and several different things, don't you? I see you doing different things out there. I've actually seen you, you see, so you can't hide from me. And neither can we. Please come up, Lucille, and get us moving. You've got your power pack on and everything. I knew you were serious this time.
Good morning. We have 5 more minutes before it's the afternoon. So aloha. Thank you. It is my pleasure to be able to share with you something that I feel that is very important and fun, exercise. I would like to thank Valerie for inviting me to teach you the Chinese exercises that I have learned in my retirement years after a career in teaching classroom children. My husband, Ken, and I teach Tai Chi at Kilauea District Park every day of the week, including an evening class. Tai Chi, as you know, is very popular. It is very safe, and it gives us better strength and probably fulfills something that we always strive to do. We try to prevent falls, and Tai Chi is one important discipline that will help you do this. The second type of exercise that I teach is called Luk Tongken. It is a Chinese exercise that we do at Kahala Mall and Hawaii Kai Town Center. It is a stretching exercise, and it also helps with our circulation. Everyone is welcome to come. We're open to all, and it's free. These types of exercises can be done by people of all range of physical abilities. Our students are men and women, as young as 20 years old, 30, most range between 40, 50, a lot of 60-year-olds and 70-year-olds, and believe it or not, 80s and 90s. We are proud to be able to say that we have a centenarian working out with us 2 times a week, regularly. She turned 100 years old in January of this year. Besides age being a factor, our students also come from all different types of health conditions. Some are strong, others have had hip replacements and knee problems. Some suffer from arthritis and asthma. Others have been diagnosed with cancer. Some go to physical therapy for their back aches and knee problems. We have participants who are just like you, those with COPD. A regular participant at Kahala Mall is sitting right here in this auditorium. At least he was. It's Roland. He's sitting in the back. Roland's wife is there also, and their son Keith. Can we give a wave to Marty? Their daughter also comes and works out with us whenever she's in town. And so they have a really good support system going, and we always look forward to seeing them. Another person in our audience is Valerie's mother, Vicky Fong in blue, sitting in the back there, if we could wave it. She is a very diligent exercise participant and is always there, and we really appreciate it too. Today, I would like to give you an opportunity to learn to move your body in a safe way. Stretch and breathe and feel good about exercising. Hopefully, build your confidence as you increase your strength and endurance. First of all, we'll do some warm-up exercises and do some stretching to help us build balance and circulation. We'll wind down with some Tai Chi movements and relax. The entire repertoire has been modified to reach out to as many of you that I can. I have selected exercises that can be done at your seats. Ideally, Luktunken and Tai Chi would require a standing position, but we can modify this and stay safe by sitting. However, since we have been sitting for a long time and it's really cold in here, maybe we should stand if you can, and you know your body limit so that you can sit down whenever you feel that you need to. Okay, why don't we go ahead and stand and let's get started, because everyone can exercise, right? So we'll start with some warm-up exercise. We put our hands at our I like this. You're relaxing, you're laughing, you're with me. Next, we're going to use our fingertips and tap up and down here again, helping us to remember, helping us to be not so stressed out. Okay, it feels good, huh? All right, let's get on to a little bit more now. Let's put our hands at our waist again. Let's turn our neck. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This one's called stretching your neck. 1, 2, 3, 4, 5. Now roll your shoulders forward. 1, 2, 3, 4, 5. Other way. 1, 2, 3, 4, 5. Now we're going to expand our chest. 1. Count with me. 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Let's do some little bit more involved ones now, okay? This one's called hands open door, okay? Fingers widespread, hands to the back, serum, yat, actually, ni, sam. Ni, sam. Sam, ni, sam. Se, ni, sam. One more. Ni, sam. Very good. All right, now we're going to squat down like we're on our horse. Okay, be careful if you're not used to this motion. And we're going to put both hands below our stomach, but one hand, our right hand, by our forehead. You don't have to do this if you don't feel you can. You're going to be riding your horse. You're going to get onto your horse, and now you're going to play your drums. Yat, ni, sam, se, look, chat, bat, go, sup. Very good. This is called hands up and down. Left hand by your side, right hand above your head, palms up. We're going to make one straight line by skimming our hips and skimming our ear and our hair. Okay, here we go. Yat, ni, sam, se, look, chat, bat, go, sup. The other side. Here we go. Yat, ni, sam, se, look, chat, bat, go, sup. Very good. Wow, what a perfect crowd. All right, here's another one. We're going to ride the horse, but we're going to box, okay? We're going to box. So we're going to open up our stance. We're going to squat down. Here we go. Hands to the back. Serum. Hey. Yat, ni, sam. Ni, sam. Sam, ni, sam. Se, ni, sam. Ni, sam. Look, ni, sam. Cha, ni, sam. Ba, ni, sam. Go, ni, sam. Sup, ni, sam. Wow, I think I forgot to bring my video camera. All right, here's a fun one. It's called crab posture. Actually, we did that, crab posture. Let's see what I can dredge up here. Let's see if we can do a foot one. So we're going to ride the bicycle, okay? But we're going to do it in two ways. Let me show you first. We're going to put our hands at our waist. We're going to kick up the sand as if we're riding the bicycle backwards. But after we ride it backwards, we're going to pedal forward. Okay, so if it's too difficult, try a little and then don't stress out, sit down, or just watch, okay? So we're balancing first on our left foot, and we're kicking up the sand with our right foot. Here we go. Yat, ni, sam, se, one more, Now we're going to pedal forward. Yat, ni, sam, se, Okay, now we're going to stand on our right. We're going to kick up the sand with our left. Yube, yat, ni, sam, se. One more. Now we're going to pedal forward. Yat, ni, sam, se. Very good. Give yourselves a big hand. We said that we would warm up. We would do some stretching, and now we get to do some Tai Chi. So we're going to try to wind down, and we're going to relax. Is Mike around? Where's Mike? I actually wanted to maybe change my position there. Huh? I think this, okay, but there's a speaker here, so let me know if I'm okay on this end with, if you can hear me in the back. I think I'd like to use this wider position. Are you able to hear me, Roland? Yeah, can you hear? Okay, thanks. Okay, so now we're going to move into Tai Chi. This is called Yang style 10 form. So if you would like to concentrate more on your hand movements rather than your feet, that's your call. You can still get relaxation and sensations that way. If you rather challenge yourself and to do both, you can do both, okay? All right. You're going to do it. All right, this, right in the middle. So Ken's going to give you a little bit more of a depth than I mentioned. So we are in a relaxed position. This is called commencing form. So you follow and you do. Your hands rotate to the middle of your thighs. Bring it up. Take a deep breath in. Blow it out. Flex your knees. You center your left hand or any hand you want. Look back. Bring it to your ear. You're going to repulse the monkey. The other side, you're going to lift up the other hand. Bring it to your ear. Repulse the monkey. Then you're going to brush your knee. You step out and brush your knee. You sit back. You do a twist step. You look at the back hand that's higher. Step out. Brush your knee. Now you're going to come back and you're going to hold your ball, your Tai Chi ball. You're going to part the horse's mane. Nice up there. Sit back. You're going to twist step. You're going to hold your ball. You're going to step out. You're going to part the horse's mane. Then you're going to meet both hands and you do a cloud hand. This is called cloud hands. Your body is pretending that they're billowy clouds. In this motion, you're relaxed. Okay, then we're going to do a brush knee to the front. Okay, just kind of moving. Brush knee to the front. Holding your ball. Part the horse's mane. Holding your ball again. Part the horse's mane. Then we can do another repulsing of the monkey. Push him away from you. As you push away, you exhale. Exhale. Open. Push. Open and turn at your torso. Follow through. Push. Hold your ball. Bring your hands up and down. Let's do that 5 times and call this closing form. Up. Up. That's 3. Forget to breathe. Up. Exhale. Up. Inhale. Exhale. Closing form. Give yourself a big hand.
Thank you. Okay, I think Val said we're ready for a nap now, but not quite, because she's got some good things to tell all of us, too. Thank you so much, Lucille. That was wonderful. And now to help round out the morning, now afternoon actually, we're going to hear from Val Chang, who is our advocate for COPD, founder of COPD in Hawaii, the coalition, and retired judge, as you may know, executive director of the Hawaii COPD coalition. Sorry, last night was a very, very late night. I apologize. And you have lots of good things to tell us. Thank you for being here. Thank you for all you do.
Okay, thank you all very much for being such an attentive audience, and especially to Lucille and Kenny for leading us. Okay, that's not the right one. Here we go. Advocacy and being heard. That is actually Senator Mazie Hirono. She and I shared a desk for about 4 months while she was having her office constructed once upon a time. And we visited her in Washington, D.C. So that's one form of advocacy and being heard. And there's basically 2 main types of advocacy that I wanted to talk about today. One of them is advocating for ourselves. And we all do this in everyday life to varying degrees. Sometimes we do a better job than others. And there's also the advocacy of advocating for all of us with lung problems, all of us in Hawaii, all of us that care about, health issues or whatever the issue is. And so one of the big reasons that, especially if you care about lung health and COPD, that we need advocates is, as you can see by this graph, funding is in red and deaths per year from various different health causes is in blue. The one on the one closest to me is the bar graph for COPD. We get approximately $118 million and 141,000 deaths a year, versus AIDS, which gets $3 billion and 11,000 deaths a year. So we need to try to come together as a community and tell our legislatures and our Congress whether we think this is a good state of affairs or not. And we can't do it alone. So just something to keep in mind and to share with people when it's appropriate. For being self-advocates, as many of the speakers, including Mary, have just spoken about, it really helps to be a good quarterback. And by that, you need to learn all you can and being here and getting information is a good way to do that. And being a good detective reporter, especially with all our healthcare professionals being so busy, it's really our job to try to keep track of what things are making life better for us or worse for us and sharing them with our doctors, because the mind meld thing doesn't work really well. Our docs cannot know, when we stopped taking a medicine because we ran out, or we thought it was making us sicker, or we thought we wanted to try something else. So if we can keep good records and be able to share that concisely with our healthcare professionals, we can use their time more efficiently, and we actually become more aware of what's working and not working. And that helps with forming solid partnerships, because personally, I much rather partner with people that can do more than say, I feel junk. And it's like, okay, what part of you feels junk? And how junk do you feel? I mean, is it like you feel the worst you've ever felt, or you're just, starting a cold kind of junk, or where are you on the spectrum? And the more we can be better at describing things, and if we can describe what exactly we need, then the better and more solid partnerships we can form. And then part of that is keeping in touch. Our doctors don't really appreciate if we call them at 2 in.the.morning for something that we really could have gotten in touch with them, during office hours or early evening instead of 2 in.the.morning on Mondays, or Sunday is even worse. And developing a team. So this is what my team looks like. It has my family, it has healthcare professionals, and it has all kinds of other people in the community, because that's actually how we build the strongest partnerships. If we bring in a lot of different kinds of people, like Lucille with her exercises, and Dr. Julie Chang and her medical expertise, and then we have mental health care professionals as well. They all have their part to contribute, and if we work with all of them, then we can build the strongest team. And we have breathing Hui meetings, as we've also mentioned. We have 3 meetings a month at different locations, and this is one of our meetings, and Charlene Bell was our speaker, and our meetings are free and open to the public, and they're at each of those locations, Polimomi, Kaiser, and Queens. And those are our times and our dates. And it's also in your program here, and also in the flyer that you got. So this has the 3 meeting locations and times, and we would welcome your suggestions of speakers, and there's always a lot of interesting people to talk to, and there's free food too. And we need your stories and your help. If you want to go talk to the legislature about anything that you're concerned about, there is a public access room that is devoted to the public, and it's at the 4th floor of the Capitol. They can answer any questions about, what bills are pending, and how to get in touch with your legislator, your elected officials. There's also a national COPD caucus, and that is devoted to COPD. Mazie Hirono is the only Hawaii delegate right now, but we would certainly love all of our Hawaii people to become caucus members, and we would appreciate it if you'd call them and say, please join the COPD caucus so we can, have better voices about this national discussion. And we are working on a state strategic plan to help us figure out how we can use our limited resources. Over 30,000 Hawaii adults have been diagnosed with COPD. Actually, the number should be over 46,000. The number in the 2011 statewide survey showed that 46,015 Hawaii adults have been diagnosed with COPD, and it's likely that another 30 to 45,000 have not yet been diagnosed. Over $55 million every year is spent on hospitalizations for COPD in Hawaii alone. And so that's one of the reasons we really want to improve care and improve knowledge so that people can get the care they need without having to go to the ER in the hospital. There is an organization called the Patient-Centered Outcomes Research Institute, or PCORI, and it's authorized by Congress to help conduct research. And they do want participation. You can go to their website. You can volunteer to submit research questions. You can submit research questions you want answered. You could also apply for grants. You could apply to be a research grant reviewer. It's all available, and they need people to participate. There's also the U.S. COPD Coalition. Upstairs, there was a COPD Digest, and that is one of the publications that they put out quarterly, I believe. If you signed up that card to let us to be on our mailing list, you'll also be getting the free COPD Digest, and you can also get the Lung Health Professional for free. It's a magazine about lung health issues, and it can go to all healthcare professionals. And let's see, competitive bidding is an issue that has been enacted by Congress to require all durable equipment companies like Apria and respiratory home care services, people that supply oxygen, they have to bid and be chosen by Medicare to continue to provide services. There's a lot of problems currently with the way this is being implemented, and the federal government is actually investigating it. There is a form upstairs if anyone has had any issues trying to get their equipment that they need, and I can help you with that after this. And there's also national legislation on trying to get respiratory therapists reimbursed for working with patients so that they can provide services outside of the hospital. Right now, reimbursement is limited to the services they provide in the hospital. And we think it would be very efficient for the nation if they are allowed to provide services in homes and in non-hospital settings. We're also hoping for more funding for COPD and lung research. And our next COPD Education Day, where did we go? Will be on, it goes too fast, Saturday, September 13th, 2014. So if you want to save the date, that will be the date for next year's COPD conference. And we're trying to have it just before the Hawaii Society for Respiratory Care's conference so that we can possibly share speakers and exhibitors if that works out. And we'd like to thank Joanne Ikihara, who's in the back hiding in the aqua shirt. She's been invaluable in setting this up and in being a friend with the Hawaii Society for Respiratory Care. She's a respiratory therapist for several decades and is very knowledgeable and runs the Polymomi group and the Kaiser group. And Pua, who is right over here, helps me run the Queens group. So we hope you will consider coming to our support group meetings and helping discuss issues that are of interest to you so that we can get the speakers you guys want as well. Dr. Julie Chang has shared her great background and new information about COPD. Charlene has talked to us about how to eliminate the blame and guilt and how to help reduce our stress levels, even subtly by tapping, and I'm sure the respiratory therapy students can use that to get even better scores on their tests. We'd like to thank all the respiratory therapists who take time out of the day to come and help us. And Mary talked about caregiving, and as she said, our website will have the resources she mentioned as well as many others. We're in the process of further upgrading our website, and please make sure that you sign up online if you have access to a computer, and then you can be on our mailing list and we can send you a monthly newsletter. Let's see. And did everyone have a chance to turn in their yellow forms? And then we can start having drawings and we can set up for the panel discussion. Glenn, did you get the cards from upstairs? Okay, so should we start setting up for the panel discussion? Okay, so I'd like to call the panelists back up so that we can sit at the table and answer questions if people have questions. Is that good?
It's not really the nicotine per se, but cigarettes have a lot of, well, there's tar, they have a lot of additives that are actually in the tobacco. The tobacco companies have been notorious about adding additives that will make you even more addictive to it. It's not necessarily nicotine per se, but what makes people keep smoking is the nicotine is very addictive. And as one of the other speakers had mentioned, it does stimulate the pleasure center of the brain. It helps to make people feel good, happy. So that's the thing that addicts you. And so when we're trying to quit smoking, a lot of time we're trying to replace that. So the nicotine gum, the nicotine patches, you're trying to replace it so that people don't have the urge to smoke. They're getting the nicotine from another source, and then we decrease the nicotine over time to get them off of that.
And then for those people that are concerned about whether or not electronic cigarettes are a good replacement for tobacco, some experts are considering it somewhat of a harm reduction. The big problem is there is not enough data. I mean, there is no regulation, first of all, because it is in one of those gray areas, and so it's not regulated by the federal government, and so no one knows what carcinogens and other things that are in it. The few studies that have been done have shown that the labeling is not consistent with what is actually in the devices. So some of the electronic smoking devices that claim to have zero nicotine have been found to have high levels, and some that claim to have high levels have no nicotine. Plus all these other additives. They have found carcinogens in some of them, and it's just, there is no evidence that it's safe, for one thing, and it does have nicotine in most of the products. Actually, it is regulated by some, the owner of whatever the property is has the right to say that anywhere smoking and tobacco products are banned, so is electronic products. But it's up to the owner of wherever the premises is. So consolidated theaters, the buses, the airlines have all banned it. So you can talk to whoever owns, like I've written letters to Costco saying, please ban it at Costco because I like Costco. And I don't want your employees to all have bad health because of whatever people are vaping at them. And there is, sorry, the Department of Health upstairs and Coalition for Tobacco-Free Hawaii both have information and suggested language for presenting to your favorite owners to say, please adopt this policy. And if you want, you can ask them to try to adopt something for the legislature for statewide. Just a thought. Okay. Questions? Answers? Yes.
I think the main reason is probably that most patients, by the time they have symptoms of shortness of breath, they have fairly advanced COPD. So if you've had a significant smoking history and your doctor will ask you how many packs you smoke, how many years. So let's say, for example, you smoke 1 pack a day for 30 years. That's a 30-pack year history of smoking. A lot of patients will have COPD, but may have relatively mild COPD, so don't complain about it. I think a lot of primary care physicians might not realize that they have COPD because the patient doesn't complain about it. I think that really any patient who's had any significant smoking history greater than 10 pack years really should get spirometry done, which is a simple breathing test. It's very inexpensive, readily available, and I think, as a patient, you should be an advocate. If you have a history of smoking, you should request that you get the, spirometry done. That's a very good test to determine if you do have COPD. So I think a lot of patients, unfortunately, don't get diagnosed with COPD because they don't get that breathing test done.
The reason my COPD was diagnosed so late, I was diagnosed at 40 with severe emphysema. I've never smoked. I didn't complain to my doctor until all the Girl Scout leaders said, Valerie, you're not supposed to wake up every night breathless. Why are you doing that? And why don't you ask your doctor? I said, I don't want to ask the doctor questions. But when I finally did, he says, I just gave you a complete physical. Your EKG is fine. You're in great health. Why are you asking me to keep doing something? I said, well, they keep saying they're going to bug me until you find out why I wake up breathless. And he's like, oh, that's kind of weird. Go to Queens. Have them give you a lung test. So I went to Queens and had Pua's partners give me a lung test at the pulmonary lab. And they said, oh, you're really doing really awful. You need to go see a lung specialist. So I did, and they found out I had COPD, but I didn't grumble. So that was actually my fault. And the doctor had no reason to suspect that I had any lung problems because I didn't mention anything, and they never asked. And they never, if it wasn't the Girl Scout leaders, I probably would have been a few more years before I got diagnosed. So a lot of people don't complain and don't grumble. And the other thing is, it's covered by nearly every insurance company. So it's really important to ask and have people ask to get tested because there's no excuse for them not to be able to get tested.
So I think the important thing is just to be an advocate for yourself. If you're short of breath, doing things you normally would do, that's not normal. If you have any significant history of smoking, you should ask to get the spirometry done. And as Valerie was saying, it is covered by insurance. It's an inexpensive test, readily available. It doesn't take a lot of time, but it could really, if you have a diagnosis, then you'd be started on treatment. It could really improve your life. Well, if you have asthma, you should have had spirometry regardless.
Then when we kind of stopped whatever was going to go on, he had the audacity to ask me, he said, might I ask you where you got your medical degree from? And I told him, I'm going to tell you what you can do with your medical degree. If you don't know what I mean, bend over, I will give you a graphic illustration. But what I'm trying to say here is that you have to be your own advocate. You have to have the guts and the balls to say, I don't give a damn where the hell you got your medical degree. I know what I think. And if we don't do that, we are going to be the losers. So, I mean, and yeah, women, not all of us have the balls to tell a doctor, but if you just barely got out of high school without getting, expelled, you cannot be so backward as to, say, okay, you're a doctor, you went through, whatever, and I'm going to concede to you. Because you know the problems you can have with breathing and all these sort of things. So my thing is, even as a woman, you have to have the balls to tell a doctor that he is wrong and give you a spirometric test. I mean, had I not done that, I would not have had, and I went to another doctor, and I did not have the balls to say, hey, you know what? Don't give me that crap. And so I went to another pulmonologist, and yes, he gave me all the testings that I should have had in the first one, and he told me you do have early onset. So the takeaway here is, man, woman, child, whoever, you have to be say, I hate to tell you with your medical degree and all of that, I think you're wrong. And you have to say, I'm going to go to another doctor. And it might cost you money, but in the end, it saves you your health. The longer you can, the sooner you get pulmonary rehab, exercises. I'm okay because I have these things. I exercise everywhere I go. And it's good exercise for my lungs. But, and I hear this all the time. I was just, I found it out. But anyway, and it's just my classmates are saying, yeah, I do. I mean, I had this, I was carrying it in this hand and going like a bat out of hell with my cup. And, they're wondering, how in the God's name are you doing that? I don't know, God gave me the wherewithal, and I've used crutches, when I was in the second grade, because I broke the ankle. I used crutches in the fourth grade. And I used crutches in the seventh grade.
Thank you, Shirley.
The thing is, you have to have the wherewithal and know your own.
Do you have a question?
You have to have a sense of self.
Okay. Thank you so much, Shirley. I was wondering if each of us could give, 3 your top 3 things you want people to take away from the today's talk.
Number one thing I would like you to take away is if you are still smoking, please quit smoking. That's the best thing you can do for your lungs, and it will help prevent your lungs from getting worse. So that's the number one thing. Number 2, as Shirley was saying, be an advocate. If you have any issues with shortness of breath, you have asthma, you're a smoker, you really do need to have pulmonary function tests done, spirometry. That's a good way to diagnose you with asthma, emphysema, pulmonary fibrosis. So if you haven't had one done, I would really recommend it. A lot of people get EKGs and other things done, but kind of forget about the lungs. So that's very important. And also just, follow up with your doctor. It needs to be open-ended. Try different medications. If something works for you, great. If it doesn't work for you, talk to your doctor, okay? Your doctor is there for you. So please talk with your doctor. Follow up on your regular visits. I think that will help your lung health. Push here, and then it goes on.
Can I just scream? Oh, thank you. Okay. Okay, I would say self-care as the caregiver and as a patient, and communicate. Everything that Dr. Chang was saying were things that I was thinking of too, and as Shirley said too, be an advocate. And if you can't, then the caregiver needs to be your advocate so you can get the information that you need. And have patience with each other. And going back to my former career, get your flu shot, both the caregiver and the patient. That's really important because as the caregiver, you probably interface with more people than the patient, and you're probably more likely to bring flu home or some other kind of infection home, which can really be a problem for the person with COPD. Thank you.
Thank you. Actually, for me, I think all of us need to remember that anyone and everyone can exercise. And it's one of the few things, when done properly, you won't overdose, you won't have bad side effects, you won't have polypharmacy, any of those things. And I think people can do the simple things that we learned today or whatever exercise works for them. I mean, whistling, singing, playing the harmonica, all of those are other forms of exercise that aren't even recognized as exercise because they're fun. So I think it's important for all of us to find what's fun, what will work, and just do it. Even if it's like for the very deconditioned patients, some of them can only do something for 1 or 2 minutes at a time. And that's fine. You can do it during the commercials. You can do it, a little bit in the morning, a little bit in the afternoon, a little bit in the evening, and, build up slowly. And you don't have to say, oh, I don't have a whole 1 hour block of time, so I can't exercise. You can even park further away and walk farther. I mean, it's just simple little things that each of us can and should do. Let's see, what else? Oh, I hope that everyone will remember to consider coming to our support groups because that's one place where you can get and share a lot more information, and they're free and open to the public, and they have a lot of really good resources. I guess the last thing I'm trying to remind people of is our webmaster, Zach Anderson, is sitting right there. He's upgrading our website. So if you guys have thoughts on how he can make it better and more user-friendly for you, please give them to him and to me so that we can make the website something that can actually be used for good resources. And I'd like to once again thank Beth Ann Kozlovich for being such a wonderful MC.
Well, thank you for letting me do this once again with all of you. Always a pleasure to see you here, and we'll look forward to seeing you back here next September. In the meantime, see what you can do to take some of these ideas and make it a better year until we see each other again. Be well, be healthy, be happy, and thank you so much for joining us today. And we have a drawing that we're going to do, don't we?
Prizes too.
Yeah, we
We
do.
have prizes, and we also have food.
Lunch.
Yeah, if you guys fill out both sides of your pink form, and they will be collected. Those are your lunch tickets, so you have to fill them out.
And do people have to be present to win the prizes?
Yes. And we're
Okay,
gonna start
so don't
drawing
go
names.
away. Drum roll, drum roll, drum roll.
Oh, yes, we're going to use these for the other prizes. Okay. You're going to choose the first prize person. And you're going to get your own copy of this 10 small skinny guides, and you can, it's the same thing that's in the DVD, but it's printed. And the winner is Roland Kirsting.
Oh, my goodness.
Woo! No, one of the students. Okay, and Lucille, you want to choose the next prize? Next prize is Minda Valdez. And this is the third prize. This one is What to Eat During Cancer Treatment. It's a cookbook. So it doesn't have to be for cancer people. Judy Suzurkawa? Judy Suzurkawa. Oh, there she is. Okay, and we can draw from these. And when your name is called, just raise your hand, and the students will come by with a prize bag, and you can choose one prize out of it. Okay, go ahead. Up there.
Aurora Alejandro.
There she is. Okay, and start serving lunch.
Luciano Pamin Luan,
Okay.
wherever.
This is
We got about 30,
Marty
40
Kirsting.
in the back.
Okay.
Olivia Au.
Maria Hamituan. Okay.
Ross Kazama.
Yeah, or they can bring them in.
Is there more? Mary Nitz.
I've just been told that if you've gotten your prize and you'd like to go out and get lunch and bring lunch back in here, you can do that too.
Alvin Okihiro.
Sam Young. Sam. Oh, over there in the back. Okay.
Aaron Anzai.
And you can eat in the auditorium. The students will bring in the food. You have to trade a pink sheet completed for your food.
A small
Gwen
bribe.
Barnett.
And the choices are either guava chicken or pot roast.
Ooh,
Choice of two.
sounds good.
Yeah. Okay, thank you. Okay.
Keith Kersting.
Sion Batulayan. Okay. Okay. Another.
Dulip Roy Dulip.
Okay.
The prize bag is coming.
Prize bags are coming. Yep. We got like.
And I'm sorry if I mispronounce this. Shabra Day.
Oh yeah. Can you announce that?
Okay.
Announce your classes.
Is it okay now?
Yeah, go
Oh,
ahead.
so those of you who are interested in the free Luktonkin exercise, it's at Kahala Mall Monday, Friday, and Saturday at 8 o'clock, 8 a.m.
8 to 9, yeah?
Yeah, 8 to 9. So easier to remember Friday, Saturday, Monday, and then Hawaii Kai on Wednesday. Okay?
Also at 8 o'clock in Hawaii Kai?
Yes, 8
Okay.
o'clock. And if you're interested in Tai Chi, it's at Kilauea District Park. We're starting new classes next week. Tuesday, Thursday, 9 o'clock, Thursday, 10 o'clock, Monday evening. Come and see me if you have any other detailed information that you need clarified.
Raynette Ching.
Perfect.
Did you do
Constance Correa, yeah, he already won a prize.
Okay.
Constance
Oh, yeah,
Correa.
he did, yeah.
I think everyone only needs one prize.
Margie Kazama.
Lisa LaPerson.
We have more?
Yeah.
Okay. Don't
Well,
hold her in the
it
bag.
doesn't look empty.
Okay.
As long as it doesn't look empty, it's good.
Leonora Wong.
Purification Aqua Lilo.
Yeah, right there.
Okay.
Maria Pereira.
Minda Valdez.
Oh, she already won a prize. Oh, well. Yeah, she did. Gary Okamura. Gary Okamura. Oh, I guess not there.
Judy Luzu Susianakawa. Lucy Rirakawa. Susie. Judy, sorry, Judy. Okay. Oh, okay.
Got a prize. Okay. Okay, we're done.
We're done. Yeah,
Okay,
we have
so everyone, remember to turn your pink paper in. Oh, sorry. Remember to turn your pink paper in to get your lunch. You can either eat in here or eat outside, whichever you prefer. Thank you so much. Okay, that's, I think.
Hey, so Val, where can I leave this? Hey, this is kind of important. Where can I leave it?
The other guy, it was on the thing. Oh, well, you want it to take with you now? You want to have him take it now? You're here? You can take whatever you want, he's right here. Why did you take it when she was presenting? You